What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. Today's video will cover, so what are the typical protocols or views in the emergency room if there is a shoulder or a hip or anything dislocated. So to give you context, I am an X-ray tech. I usually work a night shift, 7 on, 7 off, but I work a lot of overtime, so I dabble in day shift a lot. So I am versed in both worlds, which the protocol is kind of the same. It all kind of depends on the patient. It mainly comes down to the patient and occasionally what radiologist. Okay, so let's say the shoulder's dislocated. So if we shoot the patient and like you can see it pretty obviously that it's pretty dislocated, from that picture on, you want to be very, very careful, because if it's dislocated, or if it's dislocated and it's broken or shattered or whatever happened to the poor person, most likely what you'll have to do is angle the tube. So depending on how it's sitting, so if it's already internally, so you have to angle the tube to get it to rotate it externally. And as far as Y's goes, it's kind of, you probably won't get a Y. The best thing, if maybe you could do, is kind of have the patient just like the humerus will most likely be in the way, but you can set him up in a Y view-ish to see if, like, with angling the tube, it may help compensate his position of his arm. But most likely in that view, when you like shoot it this way, even though it's still kind of arched, like the humerus will be like either semi superimposing the Y or very on top of the Y. But at that case, you just put the notes and be like, I tried, to get. And mostly all the rads won't give you any problems, or even ER doctors, because they already saw this dislocated, and it's like, okay, well, you did the best you can, And then same thing, for trauma, for the hips, you just do the trauma hip view, the Dennis Miller method, and you can shoot it that way, cross table as they call it. Or sometimes you can just let up and roll them over towards the other side. If it's not broken or dislocated that bad, you kind of can do it that way, because sometimes certain patients aren't able to raise their other leg, or the other leg is also hurt. So there's that situation. And then after that, usually what happens, depending on if the emergency doctor thinks he can pop it back in place, he'll try to do that and then call you in and shoot it. Other times he's like, you know what, it's too bad, cast it, send it to surgery. That's about it. Yeah, it's been your boy Miguel. See you on the next one.